Hi, my name is Ryan, and my topic is on Prader-Willi syndrome. The etiology of this is that it is a genetic disorder that generates loss of function when a specific gene, specifically the 15th chromosome, is affected. So normally this happens through the paternal copy of the gene, and 65% of cases result from the paternal deletion. 20-30% are caused by maternal parental dysautomy, and 1 to 3% of cases are caused by imprinting defects. Next is the genetic details. As I said before, it occurs in the 15th chromosome. The specific genes that are affected are the NDN, SNRPN, the MAGEL2. So, in how this disorder is inherited, it's neither recessive nor dominant, but mainly happens due to the absence of certain genes that you get from your father. And in a similar case, or like the sister genetic disorder of this, where you lose the specific gene from your maternal side, is called Angelman syndrome. The AI models for risk assessment, like most genetic disorders, AI is used to help with the genetic screening analysis of the patients. So doctors can help better predict whether the infant or the baby in the future will have this type of genetic disorder. So examples of AI being used will include machine learning models used in prenatal genetic screening and chromosome SAML microarray interpretation that are AI assisted. So this genetic disorder is not that common, but you can see it in 1 in every 10,000 to 30,000 birds, and this is a global. And within the US, you can find it in 1 out of 10,000 to 25,000 people. So as I was mentioning before, within the United States, it's 1 in every 15,000 birds on average. In Europe, it's 1 per 15,000 birds on average as well. And in Asia, it's also a similar rate between both US and Europe. So next I'll be talking about the body parts that are affected due to this genetic disorder. So the endocrine system and the nervous systems are both the systems are mainly affected, with the hypothalamus being the most affected part of the body. Due to the hypothalamus being affected, you will see changes in hunger, hormones, body temperature, growth, and sexual development. And other parts of the body that are affected are the pituitary gland, the musculoskeletal system, adipose tissues, and reproductive organs. So in the average person, the hypothalamus, it would be able to control your growth hormones, help regulate your sex hormones, help regulate your satiety and hunger, and help maintain your metabolism. But if you were a person that was born with Prader-Willis syndrome, you would have growth hormone deficiency, low sex hormone production, reduced muscle tone, and your brain will never signal when your body is full. So you'll just be nonstop eating, and in most cases, it will lead to obesity. As for symptoms in infancy, there will be poor feeding, hypotonia, which is low muscle tone, and failure to thrive. So you just have a harder time when you're an infant compared to other infants. In childhood, you will see that these children will often be very obese because they don't know when to stop eating. There'll be hyperphagia. Their hunger will never be satisfied. There will be behavioral issues, intellectual disability, and delayed puberty and short stature. So if you see a child that is a lot shorter than the other kids and a lot wider than the other kids, Prader-Willi syndrome could be a good diagnosis for the kid. So some long-term consequences of Prader-Willi syndrome would be severe obesity, type 2 diabetes, trouble sleeping, cardiovascular disease, and life expectancy reduced. So basically just average symptoms of someone who's going through type 2 diabetes. So there is 4 main ways that it's diagnosed currently. There's the FISH testing, prenatal genetic testing, chromosomal, microarray, and DNA methylation testing. As far as treatment goes, there's currently no cures, but there are ways to manage the symptoms. The way the symptoms are managed is basically how most doctors would treat a patient that has type 2 diabetes. So, strict calorie control, growth hormone therapy, hormone replacement therapy, behavioral therapy, and manage and supervise food access. So, it's basically just type 2 symptoms, but with some behavioral issues. So, with the potential risk of treatment, since you're receiving the same type of treatment as type 2 diabetes, it would lead to a lot of use of insulin, but with the use of growth hormone can lead to swelling, insulin resistance, and hormone therapy risk. Uh, these risks will occur more often, or the risk will increase the longer you use a lot of these treatments. And also, there'll be behavioral changes. And these behavioral changes will last throughout your whole life because PWS is a chronic lifelong condition with no cure at the moment. As as I mentioned before, AI's role in diagnosis and treatment planning. So AI just helps detect it earlier, so we can better treat the symptoms early on and help keep the symptoms to very small risk, and hopefully prevent the patient from developing obesity and possibly type 2 diabetes. So there's predictive models for the obesity risk, behavioral monitoring systems, personalized hormone therapy modeling. And since there's, like I mentioned before, since there's no cure for PWS, AI can only be used to detect early and better manage the symptoms. And here are my references.